If DKA confuses you, give me 3 minutes and I can make it super easy to understand. So here's the basis of DKA. We've got all this glucose, but it's in the blood. These are the capillaries, these are the little cells. So there's glucose all in the blood, meaning it's diabetic. They have high blood glucose. But I can't use the sugar that's in the blood. I need it in the cells, but the doors are closed because usually DKA happens in type 1 diabetes who do not have insulin. Insulin opens the doors to the cells. So this glucose is stuck in the blood and none of the glucose can get into the cells where they need it for energy. So if your body cannot use glucose for energy, it will start breaking down the next best thing, which is fat. So it'll rapidly start to be breaking down your fat, which is what causes the rapid weight loss whenever patients get type 1 diabetes at onset, all right? The byproduct of fat breakdown, though, is called ketones, all right? And ketones are very acidic, which is what makes them go into acidosis. So they're in diabetic, keto, from the breakdown of fat, acidosis, DKA. That is the path of what is happening. So all of our signs and symptoms are going to come off of that. So since they've got lots of sugar in the blood, right, their blood glucose is very high, but the cells are starving, that tells their body, I am so hungry. So they get polyphagia. Poly means many, phagia means I gotta eat, so I'm trying to eat and eat and eat. Meanwhile, their blood glucose is getting higher and higher and higher, but their cells are still starving because none of this glucose can get in here because there's no insulin. So they've got polyphagia, and then their body's like, oh my God, you have so much glucose in the blood. I'm gonna flush it out the kidneys. So I'm gonna make you really, really thirsty and give you polydipsia. So you're drinking and drinking and drinking, trying to flush all of the glucose out of the kidneys. Well, when you're drinking and drinking and drinking, you're gonna have to pee a lot. So they get polyuria. So polyphagia, polydipsia, polyuria are the 3 Ps we typically see at the onset of DKA in type 1 diabetes. They also will come in with fruity breath, which is their ketones are actually breathing out those ketones. You can smell them. They are going to come in Kussmaul's breathing, that rapid breathing because they're in acidosis. So the body is going to compensate by trying to breathe out your CO2. Your CO2 is acid. So they're trying to get rid of the acid in the body by Kussmaulsing, okay? Now they will get hyperkalemia when they come in. Why? Because insulin and potassium kind of go on a seesaw. Potassium loves to be at home inside the cell, but insulin opens the door to the cell, right? So if they have no insulin because they're type 1, then the door is closed to the cell. You see that it's closed. So the potassium will stay inside the blood because it can't get home in here because there's no insulin. So what do we do to fix this hyperkalemia? We are going to give them lots of IV fluids to flush out all of the glucose and give them regular insulin. That will raise up my insulin here and that will lower my potassium because as we give them regular insulin IV, that insulin will go and open the door to the cells. And now the potassium that was inside the blood is now able to go into the cell. So we'll drive it inside of here, lowering the potassium inside of the blood. So that's how DKA works. Those are typically the first signs and symptoms that you're going to see.